Hi, I'm Mike Mew. These is our series of questions in September 2025. Is it possible to fix bimaxillary protrusion naturally? Great, lovely question. I look at bimaxillary protrusion in a very, very different way. If you look at the orthodontic community, we talk about the different classes of malocclusion. So we talk about, here's your upper teeth, here's your lower teeth. This would be what we refer to as class 1. We're going to refer to this as class 2 with the jaws back here. And then we call to this as class 3, an underbite. And these are done, all these measurements are done on x-rays, and I've got real worries about how stable the stable points are on x-rays. So there's issues here. Now, I think the problem is everyone should be up here. So this should be class 1, a modern class 1 is back down here, a modern class 2 is back down here, and a modern class 3 is back down here. So actually everything's dropped down and back, and as you get, this is craniofacial dystrophy, and as you're affected by craniofacial dystrophy, then you fall into different patterns of behavior. Okay, so anyway, we come here. So what happens to bimaxillary protrusion is as you drop down, things tip forward. So this would be ideal. You're dropping down and back, and that's happening. This is your normal position, modern normal with 28 teeth. And this is bimaxillary protrusion. What you're going to try and do is you're going to try and do that. That's not what I want to do, okay? So what I would want to do is here's your ideal position, and here's your bimaxillary position. So what's happened, these guys have dropped down. As they've dropped down and back, the tongues come forwards into that position and giving that bimaxillary protrusion. So I don't want to treat bimaxillary protrusion by taking teeth out and pulling everything back, okay? You can do that if you want, okay? You can do that mechanically, and you can get some really nice results. The relapse rates tend to be quite high, but you can get some nice results. I worry about clearly holding teeth with permanent retention, but there's another story. If you can, now the hard bit here is how to get an upswing in facial form, okay? However, people with bimaxillary protrusion generally have decent amounts of tongue space. So you're in a very good position to get improvement and change. Lip seal would really help. I tend to notice people with bimaxillary protrusion tend to have their lips apart. So really working on lip seal would be enormous. And I think you'd get a little bit improvement on the angulation of the teeth simply by getting better lip seal. But realistically, you want to get an upswing in facial height and lip seal, because I think the two of them are going to go together. And I think it would really help your bimaxillary protrusion. It's not going to be a fast change. And I bet you're going to kid yourself. You're going, oh, my lips are always together. Yeah, we're together all the time. That's what people do. People just they lie to themselves constantly. I mean, constantly I get people, I do a consultation with people and they're right in front of me. They've got their lips apart and they're telling me they've got their lips together. And I'm like, go figure. Yeah? TMJ dislocation is happening because of mewing. Because I use mewing technique since 2 years and now my jaw always dislocated and lock whenever I yawn or eating burgers. What is the reason, sir? Please help me. Well, as a general rule, we're in the Mewing app, because remember, if you're just picking things I've set up online or you're just guessing, you're going off piste. You know, you're out there with no real understanding. And in the Mewing app, I do say, be careful with TMJ, jaw joint problems. God, I mean, this is such an open-ended question. I'm going to really struggle to give you much answer because there's so many potential permutations. I think what happens with jaw joint problems is when you have one point position where you rest and another position where you function, okay? And this is really common. So what happens is most people rest with their tongue between their teeth, their lips a little bit open, and their jaw slightly open. Yeah? Oh, maybe you could have your lips together, but even if your lips are together, the tongue's still slightly between the teeth. That's a modern norm these days, and the jaw's slightly open. So then your jaw joint reforms to this position, because it's going to reform to whichever position you leave it in. So what happens is most joints, okay, they're going to form to the position they're in, okay, and that will become the neutral position. One of the interesting things about the jaw joint is it closes, it has an end stop, bang, okay, teeth come together. That's your end stop. Okay, it's a little bit like when you've got a door and you have the rebate around, or the fillet around it. You go with it, and the door hits the fillet, the door stops at that point. Now, if you hang your jaw open, it's then going to reform into that slightly open position. So then as you go to close, you're going to overclose. And well, it's just not set up for that. I mean, it can cope with a little bit, fine. Yeah, but bodies are very adaptable and resourceful. But if there's a significant difference between where you bite together and where you rest, then you're going to have problems, and that's going to happen here. And the problem with mewers is that it's not the mewing often, it's the chewing. And so what happens is people come along, Kamal, I'm going to guess you've started chewing, and you're chewing quite a lot. And it's the chewing. So what you had is you had a problem, and it was a subacute problem. You had a difference between where you rested and where you chewed, and it hadn't caused you any problems in your life. Then you start chewing, and now it's causing problems. And now it's causing most problems, clearly, as you said, when you're yawning or eating burgers. So that's when you're at greater range. So you're simply putting the jaw under greater range, and because you're putting it under greater range, it's causing more problems. That's what you'd expect. You must stop jaw chewing. As I suspect you're chewing gum and things. And then just really work on having a good suction hold with your teeth lightly together. The problem here is it's a difficult one, and I could write books about jaw joint problems, and I probably will have to go on to do that, because I can see you and a lot of other people are going to have problems from this. Sir, I'm doing mewing and my jaw development, but my maxilla bone undeveloped. How do I develop maxilla without surgery? Please make a video. Well, I kind of have. I mean, there's a lot in the Mewing app on this. If you're over 20, developing the maxilla is the toughest thing. I was a lecturer, this was weekend before last, and John Flutter was discussing this, saying he thought it was the first bone in the body to develop full maturity. And the person beside me was saying, what about the bones within the ear? And thinking, this guy might be correct. Maybe the bones in the ear reach maturity before the maxilla. But the maxilla stopped growing sideways at about 8 years old. And I think it's going to grow forwards maybe for a year or two more. But either way, 10 to 12 years old, just certainly your maxilla stopped growing. Now, if your maxilla stopped growing at 10 to 12 years, it's going to be hard to gain change. Even so, when I see people with strokes, I make a big point of using people with strokes as an example of changes that you can get at any age. Well, isn't it interesting that when you see people with strokes, the maxilla is far less affected than the mandible? My rule of thumb is that after 25, it's going to be really hard to change the maxilla. Now, things that do change it is expansion, particularly TAD-based expansion in adults. So again, you're saying without surgery, is TAD-based expansion surgery? Yes, minor surgery certainly, but it's not what people would refer to as surgery. No one's got a knife on you. It's just hard. It is hard. I mean, maybe I'm thinking, I want to go down thumb pulling and I want to learn more, and I think we're right at the infancy of mewing. And I think this is I've opened Pandora's box. I mean, hell, I've totally opened Pandora's box. This is your video. I'm giving it to you now. Please make a video. Yes. I mean, it's just hard to develop the maxilla. Okay? Don't underestimate it. All right, so those are the questions. I wanted to make a summary reminder that we're going to be looking for the best mewing outcomes. I want to hunt the world to find the people who gain the best outcomes, to learn from the people who've done it, so that we can spread the information and help everyone. My real goal is to get prevention and then move on to help you with the minimum amount of operative work to get the best results. So try and work out how we can nudge you, or you mewers, with a little bit of artificial assistance to help you get the best outcomes. And by understanding the best mewing outcomes is really going to go a long way to help learn what we can do to build this whole thing and get better results, okay? To help you fulfill your full genetic